not just working those bands, but just working. Those are an indication of sort of tension in the head, putting pressure on the blood vessels and the ligaments and various things underneath the scalp. So when we're doing this movement, we're rolling the whole scalp over the head, not pulling it that way. On somebody without hair, of course, it doesn't matter, but with hair, that movement can pull hair. So we're doing this, holding the whole scalp against the skull. This movement, applying pressure above the ears and rocking the head. And he's quite tight through here, so I'm just working through this area. A little bit awkward here on the beach. Normally I'd use a little seat or something to sit on. Here we're going to just place the back of the hand underneath the back of the skull, get him to breathe in, this hand over the chin, making sure you're not, and then just pulling straight back. Stretch his neck. Looks kind of radical, but feels good. Obviously has to be done safely. It's a pure traction move though. And after that, you can really get in there. So what we're looking for each time is we should be looking for him starting to look more relaxed as well. As he looks more relaxed, that's how we'll be able to go in a bit deeper on things. So doing his head helps to relax him, getting him to breathe into his belly. Usually making sure the person is warm is very important. Here in Hawaii, it's not such a big issue. You're warm enough, Jeremy?
Yeah. Nice time of day, actually.
Yeah, beautiful. Not too hot. You can see here I'm going in harder than I was before. He's still feeling it, but he's able to handle it.
Wrist feels kind of tight at those points.
Yeah, it's very tight. Your whole hand is tight. Same with that one. So big breath. He's almost starting to enjoy that little finger on the chest now.
Yeah, it's hard to believe it's same tension.
Yeah.
Same pressure.
Same pressure, yeah. Well, now it's my thumb.
Before I couldn't stand it.
Yeah. Yeah. Big breath. Yeah. So, you know, it's just layers on layers. And he's still sensitive down here. But we'll get rid of that soon. You can see he's handling that a bit more deep. Before I could just touch it like that. You do that. There, that was more out of fear. But that's more genuinely. That's genuine discomfort there, isn't it?
Yeah, it's pretty soft.
Yeah. Yeah, so we're stretching them, and we can really get into here a little bit more while they're stretched. Yeah. If he's more comfortable squirming around, most important thing is patient comfort. Don't forget to breathe. Okay, so we'll probably come back to that again. You can feel toes sort of clicking a bit and things moving as we loosen you up. Okay, so again coming back to this area that was tight. So good massage is not always about fancy techniques. It's about actually finding where it's tight, using particular techniques to get rid of that tightness, and working with the person. Finding your rhythm, getting them to breathe into it, getting them to relax, and just work with you. If that takes joking, that's fine. Some people you have to be serious with all the time. That's also fine. You can see I'm getting in here a bit deeper than I was before. He's almost ready to handle more sort of intense moves in there, but I'll give him a few more minutes. Well, yeah, maybe not a few more minutes. It's a trick. What we're going to have a look at here too is the particular rib area where he's feeling quite sore. What I've noticed so far is I'm picking up a fair bit of tension right in here. Can you feel that? Yeah. And you can see as I roll it, you can actually see these bands kind of rolling over there coming into his ribs. So were you doing any exercise or anything you mentioned?
The technique of surfing on my body, paddling and just, you know, jumping up from that.
Yeah.
I rested it for a while and then I started doing some ab exercises.
Okay.
And later it just ruined it.
Oh, the ab exercise. Yeah, well there's definitely some tension in here. Now this tension actually comes from here, and where you're feeling particularly sensitive. You know, whether we can get this out in one treatment or not, we're not sure, you know. But that's where we need to loosen up. We need to loosen up here, here, and then here, you know. Yeah, right. So we'll do a little bit of work on that. We're losing days kicking on here, you know. But, you know, we want to take it at what you can handle too, because I know some of this could be a little bit uncomfortable. Yeah. So I'm going just a little bit harder just because we don't want to be here all night sort of thing. But okay, so we're just gently applying pressure through there and then just giving it a little shake. So going to work all these areas because all these areas do relate to the chest. You can see how sensitive it still is here. Okay, so whether we can get that out in one treatment or not, we'll see. What I am going to do with this treatment, because you can see how sensitive it's like, we'd like to really kind of get into here, loosen him up, but it's just too much for him right now. So what we're going to do is roll you over, Jeremy. We're going to do a bit of work on your back just to get you more relaxed. So what we're going to do is basically work your back again, just work it a lot deeper this time because we've loosened up the front. That loosening up of the front, we haven't totally loosened up his front, but we've loosened up partly. And that partial loosening up will allow us to be able to get into his back quite a lot deeper. Still feeling the tension, but should be able to release a bit more. You can see all this sort of flicking over here business, and he can certainly feel that. Okay, that's just to show you where he's tight, okay? But again, we're gonna find that that will release more up there if we can loosen up his leg. So we can do techniques like this, where we're using our knuckles in the leg and moving the leg. That gets quite deep into the tension of the thigh. We can get in and just gently, not too hard on the calves, caress them a little bit, and then get into all these bands in here. He's feeling all these again. Into the side of the toe, it's a very important area right there. All into his toe. Side here, we'll often feel that little band, that like a little wire through there. I think you can feel that, can't you, Jeremy?
Yeah.
Okay, so working the whole foot, we're going to come in, apply some pressure through here. Don't forget to breathe, Jeremy. Okay, so a gentle rotation of the ankle combined with holding these nice pressure points here. Just gently shaking them, holding here as well, shaking them.